Good evening. I will be the member of government for today's debate topic, which is the United States federal government should pass Medicare for all, expanding Medicare to cover every American's health expenses. I'll be answering to arguments made by the negative side, but would first like to remind the audience why expanding Medicare to include every American would be beneficial for our country. Starting with the first harm made in the PMC. Our current healthcare system is putting many people at a disadvantage, in this case focusing on disparities in women's health services. As the PMC mentioned, while 3/4 of adult women reported women's health service use in the past 12 months, less than half received contraceptive services and even fewer received STI and pregnancy-related services. Unfortunately, further evidence proves that we are receiving an underwhelming amount of healthcare services with our current healthcare system. Many people are being forced to choose between their health and their finances. In fact, according to the New York Times in Do Women Pay More for Health Insurance by Dan Bellman, information gathered by insurance companies and online brokers shows women pay significantly higher rates for health insurance than men of the same age purchasing the same coverage. While the negative argues that there should be no change in the current healthcare system as women have access to care, it is seeming increasingly noticeable that the system is extremely flawed and we must take action as there is no reason for such disparities. The second harm was that with the current system, healthcare costs have been skyrocketing as in the United States, our healthcare system relies on borrowed funds, which creates instability. Evidence for this is shown in an article by Peter Arno and Philip Caper titled, Medicare for All, the Social Transformation of U.S. Healthcare. With this slide, the healthcare system that we run on is working as it is intended to, as nothing more than price gouging corporations. And the quote, we pay more than twice as much per person on total health care spending and on its prescription drugs in comparison to other developed countries. This spending totaled nearly 18% of our economy. It's insane how much we are paying for healthcare services when other countries are already providing those same services for their citizens with little to no cost. The third harm was that specializations and lack of general care have led to extremely high prices. One reason as to why medical care prices have gone up increasingly fast is because of overspecialization. We have too few primary care physicians and too many specialists, which is bad as it negatively impacts people's health and other aspects of their life. This is another flaw that we are facing with our current system and another reason as to why we must expand Medicare for all. The negative argued that they believe that what would happen with Medicare for all is that there would be left with a physician shortage and a patient surplus. We would like to introduce a testimony from a current physician on the matter. The article is from Congresswoman Pramila Jayapal's website titled, Jayapal Introduces Medicare for All Act of 2021 alongside more than half of House Democratic caucus after millions lose healthcare during a pandemic. With this leg, testimonies from licensed doctors who do not agree with our current healthcare system and support Medicare for all. And the quote, physicians have been saying it for years. We cannot give patients the care they need in a fractured and profit-driven system. For too long, doctors have watched helplessly as our patients delayed or skipped needed care, even walked out of our hospital doors because they could not afford to pay. While some are insured, many of these patients enrolled in commercial insurance plans but cannot afford the thousands of dollars they must pay up front in deductibles and co-pays. This is said from Dr. Susan Rogers, President of Physicians for a National Health Program. Medicare for All is the only plan that puts patients first. It guarantees health care for life with free choice of hospital provider and no financial firewall to stand in the way of health care. It's no surprise that a majority of physicians and other health providers now support single-payer Medicare for all. This was just one of the many physicians and other licensed professionals who agree that we are facing several difficulties for not having Medicare for all in place. While the negative argued that having Medicare for all would make doctors have less incentive in giving patients adequate care, many doctors, like Dr. Rogers, are recognizing that we are unnecessarily suffering without the care we need, and that they wish to function on something rather than a profit-driven system, which is what we have now. In response to the negative arguing that there would be a surplus of patients, we would like to introduce some evidence that suggests otherwise. In an article by Jacqueline Renfro titled, Harvard Researchers Medicare for All Wouldn't Overwhelm Hospitals, with the slug, evidence suggests that Medicare for All will not overwhelm hospitals or medical staff. There is evidence that contradicts the negative's argument that there would be a patient surplus with a physician shortage. The quote reads, much of the debate around Medicare for All centers on a fear that there will be a large surge in hospital use, possibly overwhelming the system. But looking at data following the implementation of Medicare in 1966 and the Affordable Care Act in 2014, researchers at Harvard Medical School found no significant increase in hospitalizations. The analysis conducted with the help of the City University of New York at Hunter College instead shows a redistribution of care, and the increase in hospital care among the newly insured would likely be offset by decreases in hospital use for healthier and wealthier Americans. The negative also made the argument that with Medicare for All, we would be stopping Medicare innovations. To this, I would like to respond with a quote from an article by Jonathan Cohn, titled, Does Universal Health Care Suppress Innovation? The quote being, the single biggest source of Medicare research funding, not just in the US, but in the entire world, is the National Institutes of Health. There is no reason why this has to change under universal health insurance. NIH has its own independent funding stream. With or without universal coverage, subsequent presidents and Congress could ramp up funding again. Innovation would most likely continue even with a change to Medicare for All. And with that, I conclude the member of government speech.